The following program is sponsored by the Medicine Center Pharmacies.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White, and we're very glad you joined us this morning. Before we begin, I'd like to thank our sponsors, Mercy Medical Center, Studio Arts and Glass, Kempthorne Motors, and, of course, our technical producer, J.D. DeAngelis. This morning in the studio with me are our special guests, Dr. Drusilla Grant and Melissa Marino, vision therapist from Grant Vision Care, and along with our own Minerva Medicine Center pharmacist, Melissa Overly, and her son, Nathan, who will join us later on today's program. Good morning and welcome to the show. So vision therapy is a specialized program which helps correct visual development and developmental and perceptual problems that are not helped through glasses or contacts. Think of vision therapy as physical therapy for the eyes and the brain. If you or someone you know has vision problems, behavior problems, or learning problems, visual therapy might help. Today we'll talk about optometric vision therapy and learn more about the types of issues it addresses. And I'd like to remind our listeners today, this broadcast is now available on podcast, which can be downloaded from the App Store on your smartphone. Look for Health Matters with the Medicine Center Pharmacy, and you can listen to any of our programs anytime. If you have questions during today's program, we'll invite you to post them on Facebook Live feed or call 330-450-1480. So, Dr. Grant, can you tell us a little about yourself and your practice and the types of patients you see?
Yes, I'm a primary care optometrist, and I practice in Cuyahoga Falls in private practice. We work with those from cradle to grave, so that could be 6 months to 100 years. Just got done seeing a 98-year-old.
Oh, wow.
Have a special emphasis and
really?
And yes, passion for those.
We need to talk about that.
Okay, sounds like a plan.
Okay.
But I have a special emphasis on helping people function with their visual system. So for me, the 20/20 and Healthy Eyes is just the tip of the iceberg. I want to see how do you use that visual system because it can impact how well you can learn in school, how well you can hit the baseball, and succeed in what you want to do.
Okay. So for parents who say their child has already passed the school vision test, and isn't that kind of routine that they test every student hearing and visual or not? Yes, and definitely
they do the screening, and 20/40 is usually the cutoff for referral. So okay. If they have 20/30, even 20/20, okay, they're not going to be referred for anything because all they're looking at is how clearly they can see, period.
Okay, so I have 20/20 vision, okay, and I really do, because I've got new lenses, okay?
Exactly.
All right. How can you help me?
Well, let me give you a little activity here, okay? You'll see what we need beyond the 20/20. So I have a sheet here, and it starts with...
You're kidding.
Writing down at the bottom left, exactly, at the bottom left. And we're going to have you read up and down. I've changed it a little bit for you.
Ooh, up and down, huh?
Yeah.
Okay.
And then I'm going to introduce different lenses and make you work a little bit. So you can go ahead and start reading out loud.
Which way do I go, up or down?
You're going to go up, follow the arrow.
They
make words.
THIS.
Mm-hmm. What word is that?
What word is that?
This?
I don't know what you're asking me.
To start reading, like normally we read across.
Okay.
Since you're really good at that
It's
already,
Japanese.
I'm going to change it on you. Okay? I'm making it work.
Okay.
So we're going to read up and down. So
I'm the host. I'm not supposed to work.
Okay.
I'm only kidding.
Okay.
I'm only kidding.
This is good though because this is what the kids go through in school.
Okay.
They're having to work and make sense out of it. So that is this.
Okay.
Because you're reading up.
Okay. Oh, gotcha. Okay. This exercise was G-E-G whiz.
Mm-hmm.
That's no good.
That's not good.
No.
Can you get it clear?
Nope.
Okay.
Fuzzy.
Okay. Keep going.
D-E-S-I-G. This is tough.
Yeah.
Why is this so tough?
Keep going because I'm interfering with your ability to see.
Okay.
Okay.
Doesn't work.
Doesn't work.
Blurry.
What happened?
A little blurrier, maybe.
Okay.
Okay.
Do you have two?
A little better.
Okay. What's the next word?
Gee whiz.
Okay, so what did you read?
What did I read? I don't know what you're asking me.
Do you remember what you read?
This was, but I don't know what the
Yeah, because, see, you were working so hard to get that information from the page into the brain that it's hard to remember what you actually read. So I changed your tracking from going across to going up and down.
Okay.
I interfered with your ability to see clearly, which is focusing, and then I interfered with your ability to use those two eyes together as a team. So the harder you had to work at any one of those skills, the less energy you had to remember what you read and to respond to it.
Okay. I'm with you.
And did you say you had 20/20?
Yes, I do.
Okay. So you see, you can still have 20/20. You can still have a lot of difficulty getting the information from the page into the brain.
Okay.
So that's why you can pass the school screening, you can pass the screening at the pediatric office, but still have problems that are interfering with learning and reading.
Amazing. Okay. Now, I understand the Japanese read up and down, but I never had to read up and down. Isn't that right?
Exactly. That's why I made it harder for you.
Okay.
Because you knew how to read across. See, I had to change it.
For sure. Okay. All right. Here we go. What about children who are struggling with reading if they're not making progress with this typical come and see you? I mean, you just put that on me, the test, okay? Now, if a child is having difficulty reading, struggling reading, why does that test help?
And this isn't actually a test, it's more a demonstration.
Okay.
But for those children that are having trouble reading, if they're not progressing with the standard help as Title I or a reading tutor or something like that, it's like, yeah, we're not making the progress we should. Something is holding them back. And it could be the visual system. So rule it in, rule it out. But we are going to look at then how well can you move your eyes? Can you move them smoothly, or do you lose your attention? You wandering, you have trouble keeping up with it. Can you keep the picture clear, which is focusing? So we look into that. And we also look at how well do those two eyes play together as a team. Because if they aren't playing together as a team and they each have their own mind, it doesn't work very well.
So
we look at all those skills.
Is that common, that the eyes don't work together, or uncommon?
From my perspective,
yeah,
I see a lot of it. Okay, and 1 in 4 in the classroom have a vision problem that's interfering with learning.
And so that's a brain issue and not a disability.
You are so good.
Is that right?
You are correct. It is. It is a brain issue. Vision is brain. It's not the eyeballs. It's brain.
So why does the brain make them work independently, as opposed to, okay, you're born a year, a couple, 2, 3, 4 years, you start to recognize things. Why does the brain do that?
Because it's under stress, and many of the problems we see have developed later on, and we can talk about how to prevent it in the down the road here. Okay. But they may have developmental delays, of which vision is a problem. Okay, especially if you have muscle problems going on, CP, MS, or other things, then vision could be the same because it's controlled by 6 pairs of muscles. But it's a matter of control, not muscle strength.
Okay. I never would have dreamed this. Okay. So, tracking problems.
It's a good dream, though, isn't it?
It is a dream. I mean, it's interesting. So what are the signs of tracking issues?
Losing your place when you read. You remember talking about your sister who was losing your place when you read, skipping words, omitting them, rereading. You do better if you use your finger to follow along.
That's me.
Come see us. And that's another good point, though, Paul.
I don't know about the finger thing, but I usually go back and read. It takes me a while in reading. It takes me a while to get into something, to get into a book, even though it may have interest to me.
Yes, you bring up a wonderful point because this is not age dependent. Okay? This can be from 2 years of age to that 98-year-old I was telling you about. Just because you got out of school doesn't mean you got rid of your problems. Okay? You've just found a way to adapt and get around them. You might not really enjoy reading too much because you're working too hard. Or a person who knits. They're working too hard. You know what? I'm just done with it. It's not fun anymore.
Interesting.
So we can help you even now.
Okay. I'll quit my job and come up.
Okay. You can talk to Nathan, and he'll tell you how much fun it was.
That's true. Okay, he can help me. Okay, so some of the signs of focusing problems.
Just keeping the picture clear. First, you have to get it clear, and then relax your eyes and look far away. So you might have tired eyes, blurry vision, headaches. You might start out reading just fine and then deteriorate because you can't sustain it.
Okay.
So a parent would see the child rubbing their eyes, maybe doing frequent blinking, pulling the book in real close. They think it gets better, but it doesn't. It only print gets larger.
What about, so what is eye teaming, and what are some of the problems with it?
Well, eye teaming, if they don't play together, you can have visual stress or double vision, or maybe at some point the brain's tired of that visual stress and it's going to turn off the information coming in through one of the pathways. And that's called suppression. At any rate, it's going to cause a decrease in your reading speed, comprehension, can interfere with your ability to bat. You might start out reading well and you just can't sustain. Words might jump on the page or move around or swim. So it's probably the main problem that interferes with your ability to read.
Okay, so let's say I have a child in school who gets very good grades, but I don't think this child is working to their potential. Could this be eye problem?
Yes, it could be. And it's worth ruling in or ruling out. And that would be the child, they're getting all A's or close to it, but they're working really, really hard to get those grades and not always getting the payback.
And that in turn stresses them out.
Exactly. And then you start to have health problems and relationship problems because all the time is spent reading. Or they may just avoid.
So why don't we take a break here? I know it's a little early, but I don't want to start another subject. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Hi, this is Brad White, your Medicine Center pharmacist. Are you paying big bucks for a little blue Viagra pill? There's a better alternative. Starting at only $4 per dose with a prescription from your doctor, the Medicine Center Pharmacy can prepare a sildenafil or tadalafil tablet that melts in your mouth for an affordable price. This allows you to take care of business and still have money left over for dinner and a movie. The Medicine Center Pharmacy has 4 locations in Stark and Tuscarawas counties. We're here to keep you healthy and save you money. Give us a call at 330-339-4466 for more information.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
That's right. This is Paul White, and the Half Off on Hot Buy store is your cold weather source. Women's Winter Tech gear boots are only $6.95. Fashion boots are marked down to $9.99. Retail value up to $60. And hats and gloves are on sale, too. New in the store are American greeting cards. 2 for 99 cents. Regular price at $4 each. Also, for snow shovels to floor mats, stop in the Half Off on Hot Buy store. Find the best deals in town.
Hi, this is JP, and I'm here with my grandpa talking about the amazing deals at the Half Off and Hot Buy store in Louisville. Visit our website at halfoffhotbuys.com and check us out on Facebook, too.
Hi, this is Brad White from the Medicine Center Pharmacy. Do you feel stressed and tired? Do you rely on caffeine, crave salty snacks, have mid-afternoon lows, and can't bounce back? These may be signs of adrenal fatigue. The Medicine Center Pharmacy offers easy saliva cortisol testing and nutritional supplements to help you get your energy back. Talk to your Medicine Center pharmacist and see if cortisol testing is right for you. The Medicine Center Pharmacy has 4 locations in Stark and Tuscarawas counties. We're here to keep you healthy and save you money. Give us a call at 330-339-4466 for more information.
Welcome back to Health Matters with the Medicine Center Pharmacy. Today I'm joined by Dr. Drusilla Grant and vision therapist Melissa Moreno from Grant Vision Care. Have a question? Give us a call at 330-450-1480 or post your question on our live Facebook feed. Where are we at?
One of the things that I wanted to point out was, as we're taking the history of the child particularly, you ask them, do they ever see 2 of anything? Mm-hmm. And there are times when they go, yeah. And the parent's sitting over there just in shock. And they're like, I didn't know that you saw 2 of things. And the child goes, I didn't know that I wasn't supposed to see 2 of things. No one ever asked me.
We don't tell you everything, Mom.
Exactly. That's a well-kept secret you don't want to keep secret.
Wow, how interesting.
So there are sometimes surprises, but...
Okay, sports. Kids play a lot of sports. If they have difficulty catching a ball, batting consistently, for example, and they still have 20/20 vision, could these issues affect their performance?
Sure, because think about it. When a ball's coming towards you, as in baseball, the ball's coming toward you very fast. You've got to react at a specific time in order to make the connection. Well, the visual system guides the motor system, and if it doesn't have good information going in, you're not going to have a good response. So you have to track the ball, you have to change focus really fast, and the eye teaming skills have to change really fast and accurately. They have to converge the closer the ball gets.
Okay.
So with that double vision that you had, would you have wanted to hit that ball?
Probably wouldn't have been able to hit it.
Exactly. And so like a batter might have really inconsistent performance. Sometimes they're on, sometimes they're not.
Does it go away when I get older?
No. Not usually. You just probably start doing other things that aren't as frustrating. And sometimes what happens is it doesn't go away, but you will you do avoid, and you will do that even in the classroom. And you start avoiding. Well, what's avoidance sound like to you?
Okay, so let's get into treatment. Okay, what kind of treatment do you provide that's different from, say, getting glasses?
Well, the first thing I am going to do is to start with glasses. But these are lenses that I call more stress-relieving lenses that help the visual system work easier and the brain to reorganize that visual system so it can function. And when it functions better, then you get rid of a lot of, my eyes are tired, I have a headache, the vision is blurred. Typically, these lenses are maybe for a year or 2 years, but not long-term. And sometimes this is all we need to do. But sometimes we then also need to help a person develop.
You change glasses, is that what you're saying? Or?
No, they may not need their lenses after a certain period of time.
Okay.
This may be all we need to do. And sometimes we need to help them develop better visual skills. And that's where you get into the vision therapy aspect.
I see. So here we are with, what is optometric vision therapy? Is it new?
No, it's not new. It's been around probably for about 80, 90 years. It's just that in the Midwest here we get things late, as with everything else. It's a series of activities that we give you to help you develop better visual skills, the ones we've talked about, as well as integration with the ability to listen, keep your balance, and think at the same time. We want you to be able to look, listen, think, and do at the same time.
When you say balance, are there balance issues?
Sometimes there are, yes. But balance is your foundation. If you don't have a stable foundation, how is that going to support the neck and the head and ultimately the eyes? And if you're not coordinated left and right, top and bottom, that's a brain function, and vision is brain, and it goes right along with it.
So what about a guarantee? Okay, I come to you, or I send a child to you, or whatever. Are you going to guarantee to me that this child is going to, or I'm going to come out of there cured? I mean, I don't know what else to call it. Okay.
Well, I'm not sure there's a guarantee on anything, but maybe your car.
Even that doesn't work.
That's true. That's true, but there are no guarantees. And I will say that the success of the program is very, very, it's very important that you follow through with the home activities that we give you. And motivation, coming on a regular basis, that kind of thing.
Okay. We have a question. I cannot read it from this post, so... the last line or so.
So it's a question from Don in Canton. He said, all my life I've had problems reading text, music, etc., and my eyes don't go to the next line from one to the next. I can't read a book. It's too taxing. Is vision therapy something that would help?
Absolutely. And that's a great question, but you are right on, because so many times we do see kids that have reading problems, and even adults, are going to have trouble tracking in music, because it's the same thing. You still have to move your eyes along a line of print, along a line of notes. So absolutely. And you're never too old to make change. That's really what vision therapy is about. And we make the change because of the neuroplasticity that we have in our brain.
I've had patients as old as 86 before, and they've seen tremendous improvement just by taking what we give them and working at home with their activities. And really, that's what we're talking about. It's an effort on the patient's part. It's not us. We're the guide. The patient goes home and does all that fabulous work at home, and that's what makes a difference.
Now, you said you recently worked with a 98-year-old patient. Different approach than a young person?
That 98-year-old wasn't in vision therapy, but we see him for general care. But as Melissa said, she's worked with an 86-year-old. So, what's fun about vision therapy is you have to know how to modify the activity for a 3-year-old versus a 76-year-old versus someone who's had a head injury or a stroke, or is it developmental delays? Because we work with all aspects.
Okay. What do you think, J.D.? We're looking at the bottom of the hour. Thanks for joining us this morning on Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
And shop the largest auto mall in Northeast Ohio with one click at KempThorne.com. Mazda, Volkswagen, Volvo, Jaguar, Mercedes-Benz, there's something for every price range. And KempThorne.com makes shopping easy, fun, and friendly. Less than stellar credit? Never a problem. And we have a huge selection of pre-owns. Kempthorne is a name you know and trust. They've been committed to our community for over 80 years. Shop KempThorne.com.
Hi, this is Brad White, your Medicine Center pharmacist. Are you paying big bucks for a little blue Viagra pill? There's a better alternative. Starting at only $4 per dose with a prescription from your doctor, the Medicine Center Pharmacy can prepare a sildenafil or tadalafil tablet that melts in your mouth for an affordable price. This allows you to take care of business and still have money left over for dinner and a movie. The Medicine Center Pharmacy has 4 locations in Stark and Tuscarawas counties. We're here to keep you healthy and save you money. Give us a call at 330-339-4466 for more information.
Brighten your day with beautiful stained glass from Studio Arts and Glass. Let the sun shine in through a stunning beveled glass window that forms a rainbow on your walls. Commission a piece of art to cherish for years. All at Studio Arts and Glass on Apple Grove and 77 in North Canton. Open Monday through Saturday, 10 to 6, or shop online at studioartsandglass.com. That's studioartsandglass.com.
We understand the one-size-fits-all approach doesn't always work. We do customized compounded medications based on your doctor's prescription to match your specific needs. Hi, I'm your pharmacist, Brad White, from the Medicine Center Pharmacy. Do you use or need customized compounded prescription medications because of allergies, special formulations, or need an easier way to take your medication that isn't available? Many physicians choose to prescribe a medication that is not commercially made and requires a pharmacy like ours with special equipment and training to prepare a capsule, suspension, cream, or tablet. Are you sensitive to lactose, dyes, or need a sugar-free suspension? The Medicine Center Pharmacy is here to help you. Every day we prepare custom medications for infants, adults, and pets in our PCAB accredited compounding lab. Call or stop by the Medicine Center Pharmacy today at 551 West High Avenue in New Philadelphia, where wellness begins.
You're listening to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. Today on the program, we're talking about optometric vision therapy with Dr. Drusilla Grant and Melissa Marino, vision therapist from Grant Vision Care, as well as our own pharmacist, Melissa Overly, from our Minerva Pharmacy. We've got a lot more to cover this morning, so let's get back to the show. So we're going to go right to Melissa. No, not going to Melissa.
So first, I'd like to give you our phone number in case you'd like to call the office. It is 330-923-9951. We're there Monday through Thursday. Give us a call if you have any questions. We're more than happy to help you. Or you can go to our website, which is grantvisioncare.com. We have quite a lot of information on there. And another great website to go to is covd.org.
And you are in Cuyahoga Falls.
We are in Cuyahoga Falls,
okay.
Yes. So we talked a little bit before about modifying a vision therapy activity. So I'd kind of like to give you an idea of why we do it and how we do it. Dr. Grant talked about, we looked at like primitive reflexes, body awareness, gross motor, because we feel that the eyes just aren't by themselves. They're part of the whole body. And everything works together. So, like, if I take a very simple activity, I have an arrow chart, okay? So the arrow chart just is a bunch of arrows. First, I would ask a child, particularly, or a patient, if they have a problem with body awareness or gross motor movement, to jump in the direction of the arrow. Then I'd have them jump and say the direction of the arrow. Now, for
you mean physically jump?
Physically jump.
Okay.
Yep, you got it. And then, when that's easy for them, I'll have them just move their hands in the direction of the arrow. Now that's a little bit finer body movement. Now they're becoming more aware of their body. Then I'll have them say it and move their hands. Now we're getting the cognitive aspect in there. We're getting the language aspect. Then I can add a metronome. Metronome adds timing. Why is timing important? Well, think about it when you read.
Metronome, that thing.
Tick, tick,
yeah,
tick,
okay.
tick, right? What musicians use, okay? When you read, you don't just read, like each patient gets individualized. You actually have some kind of rhythm when you read. And the more of a rhythm you have, probably the better reader you are. So we work on rhythm and timing. Then I can take, to make sure we're working on binocular vision, a red-green overlay, put that over top. A patient wears red-green glasses. So when you have the red-green glasses through the overlay, one eye controls one set red, the other eye controls the green. So if you have black on some of the lines, that eye's turning off. That's a suppression that Dr. Grant that she talked about. So then we do that. Maybe we'll put you on a balance board because that engages your entire body. You have to have your balance, your core going. Then I'll have you move the balance board in the direction of the arrow. So now you're using even finer body control, just that lower body to move it with the red-green glasses. So now you're working binocular, body movement, cognitive, now you're saying it also. Then maybe I'll take some bean bags. I'll toss the bean bags at you, all the while you're still on the balance. You're on the balance board, you're still saying everything. You have to bat the bean bag away using your side vision to see the bean bag. Then maybe I'll have you say the opposite of the arrows. So we can take one activity and I can go for 24 weeks and make it different for every single week. And Nathan here, he is one of my most fabulous patients in taking a activity and modifying it for our own. So Nathan, can you tell us any activity you took and modified it for yourself?
So there were actually two different activities that I kind of put together. There was the balance beam. I had to read the letters off of a wall, which we used the red-green glasses and the red-green overlay. So when I was on that balance beam, I had to keep my balance, and then my brothers threw balls at me, and I had to use all of those together. It was very complicated.
It's not about a balance beam like a gymnast?
It is. It's only like a couple inches off the floor.
Okay.
Yes. But it is.
I was visualizing him standing 3-4 feet above the floor.
So
Wait a
just
minute.
a couple inches off the floor.
Okay.
It's a lot of fun.
It
The
is.
activities are a lot of fun.
And what else did you modify?
So,
You said there were 2 activities you modified.
I kind of put those 2 activities together.
Gotcha.
So we had the one you were doing with the balance board.
Yes.
And the balls getting thrown at me. I put that with the balance beam.
And that was a great idea to do, because we hadn't talked about that yet, and he went ahead and did it on his own. Just because it was fun, it was something he wanted to do.
Very interesting. What other types of therapy are you doing besides what you're showing us? Is there any things that you have to modify because of the different individuals?
We have to modify everything. Every person gets individualized therapy. Yeah. I doubt that I do the same activity with the same person the same way at any time during my day.
Okay.
And that's because of where they're coming from. We always take them where they start, because we want each activity to be successful at first, and then we go and we find the next level that's more difficult, that's more challenging, so that they can make changes, work toward that to become successful at that. Once they're successful there, we go on to the next level. But I have some patients for arrows, they can't even jump in the direction of the arrow. So we work on just jumping, or when they're sitting down, because it's easier to sit than it is to stand. So they'll sit down, and then they'll maybe just move their whole body in the direction of the arrow. And I have some who it's hard for left and right. So they only say left or right. They don't say both until that left or right gets easy.
You can also you wouldn't give them that chart because that could be overwhelming. So
I might just give them one line or 2 lines. Okay? Because this is too overwhelming for them to look at.
Okay. A couple of weeks ago, we had a program on dyslexia. What about vision and tie-in with dyslexia? Anything there?
I do feel that there's a visual component to dyslexia. However, I do not test or treat dyslexia, but I do look at those visual problems that can interfere with their ability to get that information while they're learning to read, whether it's with that special reading method, the Orton-Gillingham or whatever, because if they have trouble getting it off the page in addition to dyslexia, that's like a double whammy.
What's your estimate, or do you have any estimates on how many individuals have these visual issues?
Well, in the classroom, it's 1 in 4, they estimate, and those that have been diagnosed with learning disabilities, it's about 60%. So it's pretty high. And that could be, as I said, your straight-A student who's not working to potential.
So, connection with learning disabilities. Are we misdiagnosing many students, many adults, whatever?
If you don't mind, Paul, I'd like to say something, especially to the parents out there, because I think lots of times things can be potentially misinterpreted or even misdiagnosed. When Nathan was between 3rd and 4th grade and he started getting the chapter books to read, that's when I started noticing especially that he was having difficulties. It would take him a very long time, about 20 minutes to try to get through a page, and he kept stopping, looking around, asking unrelated questions, and I was beginning to think at that point, does he have ADHD? Does he have a learning disability? Why does he at sometimes seem so smart, but he just can't stay on track? And I think that's where lots of kids get mislabeled, and it turned out that all of his things that he was struggling with were strictly related to his vision problems, and now that he's been through the vision therapy, he's excelling amazingly at school. He's in 7th grade, and he's reading at college level. He's doing 9th grade math, and I think he very easily could have been misdiagnosed or mislabeled and medicated for ADHD. And sometimes I think kids do have a combination of a learning disability and a vision problem, but sometimes they also are misdiagnosed. I'm very thankful that we were able to figure out what was going on and get Nathan up to Dr. Grant and Melissa, because they changed his life.
So he's now a super student.
It's amazing. It's just it's
Wow.
night and day, just to realize that what we thought could have been, a learning disability was nothing whatsoever related to a learning disability. It was simply his eyes weren't working together. They weren't tracking. And one eye would turn off. He'd look with one eye or the other eye. And he also had trouble with accommodation, which means he had trouble focusing from near to far. And if you think at school, the children have to look up at the chalkboard or the whiteboard all the time and then look back down at their page, look up, look down, look up. And he couldn't keep up with his focus with looking up and down. And so if you're just struggling trying to focus, switching from up and down, there's no way you're going to keep up with what's going on in the classroom. And just correcting these vision issues has just been a miracle for Nathan.
Interesting. Short time left here. Okay, I don't understand this question. But how about 3D movies and headaches? Are these types of headaches caused by vision issues?
So when
how many 3D movies do we have? Not very many, do we?
Well, but think about, we have the 3D comics, we have a lot of the virtual reality games, the 3D games. And when you have a problem with the eyes working together, teaming together, you can't look at a 3D movie. You get headaches. You want to take off the glasses and not even look at the 3D. But I've had so many patients after we're done with vision therapy, they say, my parents always wanted to take me to a 3D movie, but my first experience was so bad. We actually went to one now, and I saw 3D. It was so cool. And they love it because it's just so interesting and unique.
It's amazing.
And it's the first time for them they saw 3D.
Wow.
It makes them sick, too. It's just nauseous, and it's like, this is not fun.
All right. Okay. Our final break is here. Listen to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
Hi, this is Brad White from the Medicine Center Pharmacy. Do you feel stressed and tired? Do you rely on caffeine, crave salty snacks, have mid-afternoon lows, and can't bounce back? These may be signs of adrenal fatigue. The Medicine Center Pharmacy offers easy saliva cortisol testing and nutritional supplements to help you get your energy back. Talk to your Medicine Center pharmacist and see if cortisol testing is right for you. The Medicine Center Pharmacy has 4 locations in Stark and Tuscarawas counties. We're here to keep you healthy and save you money. Give us a call at 330-339-4466 for more information.
That's right. This is Paul White, and the Half Off on Hot Buy store is your cold weather source. Women's Winter Tech gear boots are only $6.95. Fashion boots are marked down to $9.99. Retail value up to $60. And hats and gloves are on sale, too. New in the store are American greeting cards. 2 for 99 cents. Regular price at $4 each. Also, for snow shovels to floor mats, stop in the Half Off on Hot Buy store. Find the best deals in town.
Hi, this is JP, and I'm here with my grandpa talking about the amazing deals at the Half Off and Hot Buy store in Louisville. Visit our website at halfoffhotbuys.com and check us out on Facebook, too.
Hi, Paul White for the Medicine Center Pharmacy, a locally owned Health Mart pharmacy. Do you know that we partner with Mercy Medical Center to provide low-cost blood screenings in our pharmacies? You can choose from the following screenings: thyroid for $5, lipid profile for $8, total cholesterol for $2, glucose for $2, and A1C for $10. These are the same tests you would receive from your physician. Please give us a call at 330-454-8772 for dates and locations. Come see us at your local Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia. Health Mart, caring for you and about you. Welcome back to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're talking about vision therapy this morning, and Melissa Overly, our Minerva store pharmacist, is here in the middle of the studio with Dr. Drusilla Grant and Melissa Moreno, vision therapist from Grant Vision Care. So getting back to the show, we're going to go right to Nathan, who spoke a little bit so far, but we want to hear some of his experiences.
So, when I was in 4th grade, reading was one of my least favorite things. I could not read a page. It took me 20 minutes, and I didn't remember anything. It was my least favorite thing. But after vision therapy, I loved reading. It was one of my favorite things to do. I can now read a pretty big chapter book in a week or so, and it's a lot of fun.
That's awesome. That's great. So what do you want to be when you grow up?
I want to be a pilot, and I think this will help me a lot.
I think you are right.
Wow. Interesting. So, what about social skills? I mean, did this affect your social skills? Do you play sports? I mean, what all are you doing at school?
So I play soccer. It's my favorite sport, and after vision therapy, it was a lot easier. And I'm in the math tournament.
Oh, really? Wow. Now, what about the baseball thing where the ball's coming at you, or basketball? I mean, I realize in soccer it's on the ground pretty much, even though it's in the arcade. What about baseball? Have you played baseball?
I played baseball when I was younger. Okay. I don't know really how good I was, but it wasn't my favorite thing because
that was before he had vision therapy.
Yeah, that was before.
Yeah, okay.
2nd grade.
I have a patient right now who is a softball player, and she's been through 12 weeks of therapy. And before I gear everything mentally for her to softball. She's 13. If I don't gear her towards softball, she won't do it. If I tell her it's going to improve her softball, she is right on it. She works on it for 2 weeks like you would not believe. She came back and she goes, I'm hitting the ball every single time now, without fail.
Huh.
She was so excited.
Oh, interesting.
And that's so cool because you know how to motivate them. You know how to hook them in and get them to do what you need them to do. It may not be what the parents are necessarily caring about, but the child does, and you still get there.
Because the patient has to do the activities, not the parent. The whole thing is if the patient works at these activities, they're going to see success. So it's the patient who makes the difference. We're just the guide.
And we see changes. You've seen it after 2 weeks.
I've seen it after 2 weeks.
2 weeks. And definitely at 8 weeks when they have their progress check, there's definitely changes there.
So, Nathan, 5th grade?
Right now?
Yeah.
I'm in 7th grade.
Oh, aren't you really? Oh, jeez. How old is he?
I am 12.
Wait a minute. Is that the right age for the 7th grade? Or is he advanced? Have you advanced? Or?
I'm actually in advanced math, so I'm actually doing 8th grade math.
Okay. We were just talking about division and math division and how they're teaching it a totally different way than when I was in school. Are you familiar with... They're telling me it's a tougher way to learn it. Because you wouldn't be able to compare.
I know there's 2 ways to do it. The one way that a lot of kids do it, I don't do it that way. Okay. So it's complicated. I don't get it.
I love it. Well, that's wonderful. What you folks have done, what Nathan's done, Melissa's done, is wonderful. Kids are precious. Okay, how about a couple more things we'll bounce around here. Once a child turns 7, nothing can be done if they have one lazy eye. Is that true?
No, absolutely not true. It can be done at any age. True that it's easier when they're young, as long as we have cooperation. But no, it can be done at any age. And that's a real common myth is they think that they hit that magic age, that's it, nothing can happen. But that's actually been dispelled because a doctor who was born with eyes that crossed, her name was Susan Berry, and she teaches up in New England at a college, and she was born with crossed eyes. She had 3 surgeries, went through 2 years of vision therapy, and saw 3D for the first time. And she couldn't figure out, how is this possible when I shouldn't be able to do this and make changes? And she actually contacted the researchers who came out with that statement, and they said that that was misinterpreted, and as long as those cells were there in the brain and they were active after they were born, they've just gone dormant, and she had to wake them up. So that's pretty exciting.
Yeah. Okay. You're talking about, we were talking earlier in the show about the patients doing home assignments, home therapy. What is that about? I mean,
we need to reinforce what they've learned in the therapy room. You need to do that activity at least every 3 days in order to make changes. We're talking about neuroplasticity. Mm-hmm. And so we need those fibers in the brain to keep firing those pathways.
So a typical therapy treatment with you folks is like once a week, and then you do your things at home?
Once a week for 45 minutes.
Okay.
And then some of the activities we give them are we do only in the therapy room. Other activities, we teach them how to do it. They go home, they work on it. Those back up everything that we do. It all works together, but the ones they do at home just really reinforce those pathways.
So what would the beginning therapy be with a student like Nathan?
So the first thing I would do is I would show him how to control his eyes and how to move them. So we have an activity for eye control. Then typically I'll give them something to do maybe primitive reflex-wise, gross motor-wise. Then after that, I'll give them something fun. It's called Straw on the Target. And it's basically how to learn how to guide and follow with one eye in. A lot of times at the beginning, we work one eye alone because we want each eye to be on the same level playing field.
Do you cover it?
Yes, we do.
Okay.
Just with a piece of tape.
Okay.
We want them to be together on the same level playing field. And then when they can each work independently, then we can start to put them together because now you have control over both eyes and now you can use them together.
Sort of like an eye exam when you go in there and they check one eye and check the other eye and check both eyes. Mm-hmm. These ophthalmologists aren't too far off the gate. Okay. All right, well, that's very interesting. And if a patient doesn't do his homework?
You'll see progress, but it'll be much slower.
Okay.
Much, much slower.
Okay. And
Nathan was a really hard worker, and he did an excellent job of doing his activities at home. He probably worked, honestly, it's not as big of a commitment as some people think, but it is important to do it every day. He probably did about 20 to 30 minutes, no more than that, at home, probably about 4 or 5 days a week, and he was very dedicated to it, and that, I think, made a huge difference in his outcome.
I always tell my patients it's about the quality of work you do, not about the quantity of work you do.
Okay. So 15, 20, 25 minutes, that'd do it. Yes?
Exactly, yep.
Other students, other individuals, longer, shorter?
It depends on the age of the child. A 3-year-old, you're going to be lucky if you get 5-10 minutes total. So you work a couple minutes, let them play. Come back, work a couple minutes, let them play. Again, it's about the quality of work.
And doing it frequently. Mm-hmm. To do, I haven't done it all week, I'm going to do it for an hour, is not what we want, because it needs to be the repetition on a regular basis to get those fibers to fire and do what they need to do.
Guess what, folks? We're out of time. Okay? Unfortunately. Okay. Thank you to our very special guest, Dr. Drusilla Grant, Melissa Marino, vision therapist from Grant Vision, as well as our Minerva pharmacist, Melissa Overley, and she's going to run in the Boston Marathon in April. So watch out for her and her son Nathan. We'd like to remind our listeners, if you suspect you have a medical issue, make sure you contact your healthcare provider. And thanks to our sponsors, Mercy Medical Center, Studio Arts and Glass, Kempthorne Motors, and of course our technical producer, J.D. DeAngelis. As always, we thank you listeners for joining us on Health Matters with the Medicine Center Pharmacy. Join us next week when Dr. Todd Miller, vascular surgeon and medical director from Mercy Medical Center's Wound and Hyperbaric Center, as well as Kimberly.
Thank you for joining us for this edition of Health Matters with the Medicine Center Pharmacy and your hosts, your pharmacists Paul White and Brad White. Remember, you can get more information right now at medshoprx.com. That's medshop.rx.com. Be sure to join us next Friday at this time for Health Matters with the Medicine Center Pharmacy. The preceding program was sponsored by the Medicine Center Pharmacies.